if you're over the age of 40, cataracts can become a real issue, but you might be surprised with how easy they are to fix. Sponsoring our segment this afternoon is Chittick Eye Care, and with me is Dr. Sola. Welcome back.
Thank you.
Tell us a little bit about your expertise again. It's cataracts and glaucoma.
Correct. Yeah. So I'm a surgeon. I'm an eye surgeon, and I specialize in cataracts and glaucoma. I do over 30 different types of procedures, but the bread and butter procedure I perform at least 40 to 50 times a week is cataract surgery.
All right, that's a big one. So when it comes to co-management, when you're doing like cataracts and glaucoma, I'm sure you see a lot of patients, probably older patients, that have both those things going on at the same time. How does that work?
Well, nowadays we're very fortunate that there's so many different types of procedures we can do for glaucoma that at the time of cataract surgery, many times I can tackle both things at the same time, cataracts and glaucoma. I'm a big fan of minimally invasive glaucoma surgery. For instance, there are many different types of procedures we can do nowadays to try to lower pressure and also stop some of the medications that patients have to take sometimes for many years, that it can stop them at the time of cataract surgery if we do a glaucoma procedure to keep the pressure under control. So you can actually tackle both at the same time.
At the same time, and then, you know, why do it all at different times? It's more painful. You can do it at once, get it done, right?
Absolutely.
Well, let's talk about cataracts today. I understand there's a laser-assisted surgery that's available that makes this procedure pretty, I don't want to say simple, but you know, maybe easier than it used to be?
Yeah, no, absolutely. I'm very excited. Here in Illinois at Chittick Eye Care, we have the femtosecond laser. It's honestly the latest laser available in the market. It basically allows me to complete certain parts of the cataract surgery, the capsulotomy, which is one of the first parts of the cataract surgery. It helps me correct astigmatism, which is when the eye is shaped like a football instead of a basketball. 80% of the population has some degree of astigmatism, and the laser actually allows me to correct that. It only takes about 15 seconds to do the laser.
15 seconds.
I know, it's really exciting. And I tell patients it's actually a better laser than the one I had at Harvard Medical School, which is really, really exciting.
Over at Chittick. You guys have the best of the best over there.
We really do. We're very fortunate that we have a great management team at Chittick that allowed me to really get the latest technology, and I'm able to offer it to the patients here in Illinois.
Now, how does this surgery differ from the more traditional methods?
No, absolutely. So femtosecond assisted cataract surgery, again, it allows me to do parts of the cataract surgery. It allows me to break the cataract in advance before I finally remove it. So the energy I use during cataract surgery is usually lower. So there's some patients, for instance, who have other diseases. They've had trauma in the eye, or they have swelling of the cornea, and many times using the femtosecond laser allows me to have a better result for the patient. It also is more precise. So when you pair it with premium lenses, or many lenses that let you see multiple distances, for instances, or correct astigmatism, and when we pair that with a femtosecond laser, which we always do at Chittick Eye Care, the results are spectacular. Patients can see better, they have more freedom from glasses, and that's what a lot of patients are looking for.
So when you're talking about premium lenses, you're talking about the intraocular premium lenses. These are lenses that go into the eye.
Correct.
Tell me about that.
Yeah, and you know, I always remind patients, because patients are like, oh my God, you're putting a lens in the eye, but the reality is the eye is like a camera. There's a lens in the front. That lens gets cloudy as we get older, and when we do cataract surgery, what we do is we remove that cloudy lens, we replace it with a clear, thin lens. We can always use a lens covered by insurance, and I tell patients you're still going to get a good result. However, you can actually use these premium lenses to get more freedom from glasses, and a lot of patients are really looking forward to that. They've worn contacts for many years, they've worn glasses for many years, and the possibility that they could be free of glasses is very exciting. And again, the femtosecond laser and the premium IOLs can actually allow for that.
That's incredible. And then not just like, so we're doing two things here. We're repairing vision, and we're getting rid of the cataracts.
Correct.
So you see better, but you also don't have that cloudy, so being out at night, like a lot of the problems that you have when you start to get cataracts, those all go away.
Yeah, they usually all go away. And yeah, and cataracts are, you know, cataracts, one of the first signs is basically not being able to drive at night. So that's one of the first things that brings people to the optometrist or the ophthalmologist. And we can remove the cataract. As soon as you're having symptoms, we can remove the cataract and make that better.
That's awesome. Well, listen, Chittick, you guys do it all over there. You guys can see your optometrist, and they can refer you to the ophthalmologist, which is you. Yeah. And then you guys can take care of that and get it done.
Yeah, and it's very exciting because, you know, a lot of people don't know this, but there's data that shows there's going to be a shortage of eye surgeons in the next 10 years. And I think this model we're trying to create at Chittick, where we collaborate the optometrist and the ophthalmologist, is really the be the way of the future. And it's great that I get to teach all these optometrists about all the nitty-gritty of glaucoma and cataracts, and I think we just form an excellent team, and
that
I think
is
this
awesome.
is the way of the future.
I love it. I love what you're doing. It's happening here in Central Illinois. We appreciate Chittick Eye Care for sponsoring our segment today. If you want to learn more about Dr. Sola and the services that he's now bringing to patients, just head over to CILiving.tv after today's show.